My article today is CRMC reactive protein and periodontitis, a systematic review and meta-analysis. What a systematic review is, I'll kind of talk about later. And for meta-analysis, basically this article is using statistical analysis to prove that there is significance in their claims. So what this article, there's two hypotheses in this article. First one is periodontitis has been associated with low-grade inflammation as assessed by C-reactive protein. And the second one is the treatment for periodontitis can decrease CRP serum levels. The aim of this article is trying to prove that the hypothesis is true, and they're also investigating in order to tell us that the treatment can decrease CRP levels. They investigated the impact of the two different modalities for treating periodontal disease, which is intensive, which means surgery, and non-intensive is what hygienists do, what we do, SRP. They use 4 different electronic databases, which they listed here, and they also tell you that the upper limit of the dates within their sources was February 2021. However, when I looked into the references, the oldest source they had was 2000, so they didn't quite have a restriction as to how far back they can go. They did, however, have a restriction as to what their upper limit is, because this article was in 2021. So any sources they found from 2000 all the way up to 2021 is what they used. And let's see, they also told you what guidelines they abided by. They let you know that they studied the risk of bias of the claims that they had, which I believe is also like a good way of proving that there was no bias, because they explicitly tell you that. We'll talk more about that in the article. And for the amount of studies that they screened 485, actually a lot more, but for the introduction sake, I think they just put 485 studies, and of that, they chose 77 case control studies and 67 interventional trials were included within that 77. They added the p-values, which tells you that there's a statistical significance in their claims, as long as it's below 0.5. And let's see, they also said that basically they're saying that from what they gathered from their studies comparing the two different modalities for periodontal treatment, they discovered that intensive NSPT, which is the surgery, induced an immediate increase in high sensitivity CRP levels, followed by a progressive decrease after treatment for up to 180 days. So they don't know what happens after the 180, but they do know for sure that it's decreased within that 180. And again, they added the p-value, and they ended with the hypothesis again. So for the introduction, they basically introduced periodontitis and how CRP is linked to that. CRP being an acute phase protein mainly produced by the liver in response to infection or tissue damage. And infection or tissue damage, we're focusing on periodontal disease. And in this section, they're basically trying to give you a rationale as to why they're trying to prove their second hypothesis, because although there's already previous systematic reviews suggesting the elevated CRP levels in patients with periodontitis, so there's already an association between perio and CRP levels, there has been inconsistent evidence-based outcomes on the effect of the two different modalities. And then here's just the hypothesis. Their hypothesis again. I don't know why I put thesis. That's my fault. They gave you an abbreviation section, which tells you what each abbreviation means. And protocol and registration, again, it's the guidelines that they abided by. Here, this is what makes it a systematic review, this entire section, because a systematic review by definition answers a defined research question, which is their hypothesis, which is 2 of them. And to answer those, they collect and summarize all empirical evidence that fits pre-specified eligibility criteria. And those criteria are listed here. That's what narrows and really hones in their focus on what they're trying to prove, which is the hypothesis again. Research strategy. Again, it's the guidelines they use, the statistical methods that they use, and they say that no restrictions were applied regarding the publication year, in terms of the sources that they used. So again, goes back to, they didn't have any restrictions as to how far back they can go, but they were, however, restricted on how recent their data was. So February 2021. Study selection, they're saying that there were 3 main investigators that screened the titles or abstracts of the reviewed studies, but if any disagreements were resolved by discussion, any disagreements were resolved by discussion with a 4th author. So there's a 4th one just to kind of mediate if any disagreements were to arise. And then for measurement reproducibility, which is another big thing about articles or studies, is its reproducibility. If you can reproduce it, then it shows that it has some sort of legitimacy. Because then if someone were to say that that article was false or if something was wrong with it, then they can reproduce it. So measurement reproducibility purposes, inter-examiner reliability following full text assessment was calculated via kappa statistics, again making it a meta-analysis. Data extraction just talks about it kind of just elaborates on the study selection, that there were 3 reviewers. And then this one is going to be the hypothesis again. Risk of bias is, this part just kind of tells you the rules and how they categorize the risk of bias. So there's what makes something low, in terms of risk of bias, what makes it low, moderate, or high. And then for results, let's see, the results kind of just tells you more about the claims, and then they support that with the different statistical outcomes that prove it is a good, or it has legitimacy to it. So they put the kappa score and the confidence intervals. They put the p-values in later, and also they start using standard deviation. But again, we'll talk about that later in the article. Study selection, it says good inter-examiner reliability was confirmed. And then characteristics of the study, they tell you how many articles they used. 77 were case-based controls, and within that 77, 67 intervention studies were included. 2 studies had their data reported. Oh, this is just telling you why that, because if you look at the references, there's actually less than 77, and they tell you why there's less than 77 listed there, because 2 studies had their data reported in more than 1 article. That's why 2 papers were grouped under a single name study. And let's see. Again, here they just say good inter-examiner reliability was confirmed at the risk of bias assessment, and that is going to be according to the claims that they put in diagnosis and periodontitis and CRP levels. So the 3 claims that they had, that they back up with p-value, was that ratio of measure, confidence intervals, and yeah, basically those guys. Though they give you the values of that to prove to you that what I highlighted here is true. So chronic periodontitis was associated with an increase of CRP and high sensitivity CRP levels. Aggressive periodontitis was associated with an increase of CRP levels versus chronic periodontitis. And also when comparing different diagnoses, aggressive periodontitis was associated with 56% higher CRP than chronic. So basically this is just this. And the last claim they had was non-intensive periodontal therapy was associated with a progressive reduction of high sensitivity CRP values up to 180 days after delivery. And then intensive periodontal therapy resulted, however, in a sharp increase of CRP. Then it would taper down after up to 180 days. And here is the graph for that. This is going to be the intensive, so the surgery. There's that spike of CRP values, and it tapers off to a consistent level, versus non-intensive, which is SRP, where it actually dips down, goes up, and then tapers down in terms of CRP levels. And last part, this part I'm a little bit concerned about in this article, because throughout the entire study, they in the title and in the abstract, they never once mentioned how CRP periodontitis, periodontitis is associated with CVD. And out of nowhere, they just brought this in. So, kind of reading this threw me off, and I feel like they really didn't have to um, place that in here. I can see the association with it, however, because it wasn't talked about in the beginning, I didn't see the point in bringing that towards the end of the article. But they talk about how CVD is linked to that. They give you statistical analysis. I just feel like it's out of place. And then they give you a graph as to how periodontitis can trigger that CVD, and then do the whole inflammation, hypertension, or sorry, not hypertension, but how that inflammation can affect CVD. Strengths are and what the limitations are in this article. One being the results are not applicable to all patients with periodontitis. I thought that was just a given. I mean, we all know that we can't just do like a one shoe fits all kind of thing. So it's always going to be a case by case, but this is going to be kind of just a general rule of thumb that periodontitis does increase CRP levels. And they put additionally, most studies did not include control groups. I think that's a huge one because you need something to compare in order to see how far you've deviated from your control. And if you don't have a control, it's a little bit harder for you to measure what those deviations are. They also quickly mentioned smoking habits, which I believe should not have been placed there because this is, again, the CVD, cardiovascular disease situation all over again. They didn't mention that before, so I don't know why they're mentioning that now. Their strengths, though, they say that our systematic review, however, was designed to follow a strict protocol with robust methodology and extensive research for all relevant evidence, which is good because then we know that it's a little bit more reliable. And they also use two meta-analytical approaches. So in case something were to go awry with one, they can recheck that with a second, and I think that's good. So they have their own checking system. And in conclusion, they stated that all those everything that they were trying to prove was correct. That periodontitis is associated with raised CRP levels, and it was especially greater in patients with more aggressive gingival inflammation, or periodontitis actually. Let's see. Further periodontal treatment, whether performed in an intensive or conventional fashion, makes changes in CRP, including a sharp increase over the first week and then a progressive reduction up to 6 months. We saw this, they demonstrated this with a graph. The study was undertaken in University College Hospital in London, and I think that's going to be a branch or a college within University College of London. And they received a portion of the funding from the Department of Health's NIHR. NIHR stands for National Institute of Health and Care Research. One of the authors actually holds a clinical leadership supported by the NIHR, so I guess that they were able to get funding from there because of this author. I feel like that could be a possible means for bias. I don't know, but because they hold that lectureship supported by NIHR, who funded them, there's a possibility there. It's just I can't prove it. And then national funds were also given through the FCT, which is Foundation for Science and Technology. Supplementary material, this just leads you to the article website, so you have an electronic copy of it. And then here we have references, and then they disclose conflict of interest. The authors declare that the research was conducted in the absence of any commercial or financial relationship. So even though that one author has a clinical lectureship supported by the NIHR, they claim that no conflict of interest was there.